I just want to cover three of the more common brain tumors quickly. There's metastatic disease. That's becoming more and more common, I see, as patients have cancers elsewhere in the body. The next one is meningioma, which is really not a tumor of the brain, but it's more of a tumor of the brain lining. And I want to obviously cover primary brain tumors. The astrocytoma is the most common one, but there's also other ones there as well, oligodendroglioma and lymphoma. Today I'm just going to cover the astrocytoma. First I'll cover the metastatic disease. You see this is a patient with a melanoma, and you can see all of these. Then this is why we need gadolinium. This is for the contrast really brings out all of the tumors here. Now the question is, well, would I be able to see this tumor without gadolinium? Sure, I could see that, but I wouldn't be able to see all these other little ones that are on the periphery here. And that's why contrast is so important. That's why with all brain tumor patients, we always get contrast. Next is the meningioma. And this is, you see this lesion here, it's not actually in the brain. It's actually pushing the brain up in this case. It's arising from one of the sinuses called the sphenoid sinus. And you can see as it pushes up, it's actually pushing the brain apart and away from itself. Okay? Meningiomas most of them are benign. And some of them don't, if they're small enough, I would say most of them, if they're small enough, don't need to be treated. Okay, so for the bulk of the talk, we're going to be talking about astrocytoma. Just to cover the World Health Organization grading system, there's only a very small subset of grade 1s that I won't cover, and that most of these occur in children. Beyond that, you have a grade 2, which is a low-grade astrocytoma. Grade 3, which is anaplastic. This is a term, it's a pathologic term that we apply to it. And the last one is what my mom suffered from, which is a glioblastoma multiforme. That's the most common one, the GBM, out of all these astrocytomas. And I think it may be the most common one because that's when patients present, unfortunately. Sometimes patients don't even know that they may have a low grade, and it eventually may become a high grade. And that's when the patient shows up into the ER or at a neurologist. So this is the low-grade astrocytoma. When I look at these images, these are the kind of the clues that I look at. This is, it's very bright, it's T2 bright. And on a post-contrast image, I don't see any enhancement. So these are clues that tell me that this is a low-grade or a WHO grade 2 astrocytoma. If we go up, there's a mass that's here in the thalamus, all right? And this lesion does enhance. I don't really see a big necrotic center to it, and so I would tend to think that this is an anaplastic astrocytoma. And this is what I would tell the neurosurgeon, okay? As we move up, these are two patients with GBMs. And this is a large lesion here. And you can see the areas in the middle that aren't enhancing. That's necrosis or dead tissue, all right? This lesion here as well. You see this mass here, and there's no enhancements in the middle. These are GBMs, and I'm usually pretty confident in saying that it is such. Sometimes lesions like this, I can be fooled, because a solitary metastasis can have this appearance too. So the patient has a lung cancer. Sometimes I can be fooled into thinking this is a GBM when it's actually a lung cancer. And therefore, oftentimes patients will then undergo a full body scan just to see if, a full body CAT scan, to see if there's any primary tumor that may be going to the brain. This is an entity that's got a very poor prognosis. It's kind of subtle, but if you look at this image here, this is normal looking brain back here. But more anteriorly, you see all this signal. It's a little bit whiter than what's going on back here. And right here, there's a little bit of enhancement. So this is what's called gliomatosis cerebri. Glioma was the old term for astrocytoma. So gliomatosis means that there's glioma everywhere. And unfortunately, all this is tumor. This happens to be the only enhancing portion. So if the biopsy were to happen here, and this is where I would tell the neurosurgeons to go biopsy, this focus right here, because this may be a focus of anaplastic astrocytoma, the grade 3, whereas the rest of it could be grade 2. So you see, the imaging can guide our biopsy and also our diagnosis.